What if healing was never meant to be done alone? Discover how Thailand's multipolar approach to mental health blends ancient traditions, spiritual practices, and community networks to support well-being.
Hello, this is Dr. Hugo Gonzalez, clinical psychologist. Thank you again for joining our Mindfield YouTube channel. If you like this program, please give us a thumbs up. Please also follow us. So in the Western world, when we talk about mental health, we often talk about chemistry, a chemical imbalance in the brain, a prescription, a diagnosis from the DSM. This is what we call a unipolar view, medicine looking through a single lens. But what if anxiety isn't just a brain disease? Depression is a soul loss. What if psychosis is a spiritual crisis? Come to Thailand, a country where universal health care meets ancient temples, where a patient with psychosis might see a psychiatrist in the morning and a spirit doctor in the afternoon. This is a superstition. This is multipolar care. In the next few minutes, we are going to dismantle the Western monopoly on mental health and explore how Thai wisdom, from Lana rituals to Buddhist psychology, is offering a global solution for anxiety, depression, and psychosis. World Health Organization tells us that depression is a leading cause of disability worldwide. We have SSRIs, we have CBT, and yet the crisis worsens. The Western model, what we call unipolar, reduces distress to biology or individual cognition. It treats the patient in isolation, but in collectivistic societies, like Thailand, this approach often falls short. You cannot heal the mind without healing the relationships and spirits around it. As one study on Thai mental health notes, suffering is not just a medical event. It is often viewed through the lens of karma or elemental imbalance. To ignore that is to ignore the patient entirely. This is where Thailand offers a revolutionary idea: multipolar care. No alternative medicine, but science, but integration. So let's talk about Buddhist psychosocial therapy. The first pole is Buddhism. Researchers have developed a Buddhist-based psychosocial therapy specifically for severe mental illness. At places like Sarian Hospital, doctors integrate the anapanasati, mindfulness of breathing, with family counseling. Why? Because Buddhism teaches that the root of anxiety is attachment and ignorance of impermanence. We use the Four Noble Truths as a diagnostic framework. People say in Thailand, the suffering is the symptom, the cause is the craving, the cure is the Eightfold Path. A 45-day program combining meditation, ethical precepts, sila, and dharma thoughts shows significant recovery in patients with major depression and even suicidal ideation. This isn't faith healing. It is cognitive restructuring using 2,500-year-old technology. For anxiety, specific temples teach tranquility, meditation, samatha, to lower arousal, and insight meditation, vipassana, to reframe the self, directly countering the egocentric rumination that fuels Western anxiety. But the mind is not separate from the body. In the West, we go to the gym for fitness and a therapist for feelings. In Thailand, they are one and the same. Ruesidanto, which is the traditional Thai yoga. Unlike passive meditation, this is an active, sweaty ritual. A 2025 clinical study on university students with depression found that just 3 50-minute sessions a week for 8 weeks noticeably reduces depressive symptoms. This is the multipolar secret. While the West chases a single magic bullet, Thailand uses a cocktail: herb, movement, and breath, all aid at restoring the balance of the three dhatu: earth, water, wind. So, what are the rituals and community healing? Perhaps the most radical difference is the treatment of psychosis and severe distress. In the West, a voice hearer is sent to a locked ward. In Northern Thai, Lana traditions, they call the spirit back. A study on Lana spiritual rituals describes the soul restoring ceremony. When a person experiences Sit Vipayasa, a distorted mind, the community gathers. A ritualist performs a swepchata, a ceremony to invite the wandering soul back to the body. This is not just poetry. This is social psychiatry. That includes the ritual. It gives a narrative to the chaos. Your soul is lost is a less stigmatizing diagnosis than schizophrenia. Second, the community. The patient is surrounded by family and neighbors, offering moral support, a built-in support network that Western medicine tries to replicate with their programs. Third outcome. Ethnographic data suggests these rituals work through the placebo and meaning response. Powerful physiological changes driven by beliefs and belonging. At Siroya Hospital, the most prestigious medical school in Thailand, they have operationalized this into Clinic Rak Jai, Love Heart Clinic. Here, applied Thai traditional medicine meets Buddhist counseling. They treat somatic symptoms not as faking illness, but as a real imbalance of the elements. So the takeaway from this conversation, what can we learn from Thailand? Integration over exclusion. Thailand has integrated mental health into universal health coverage, but they allow a space for cultural wisdom. The UN notes that Thailand is a leader in the Live Life suicide prevention package precisely because they use digital tools and community elders. The pathologizing distress. In the unipolar view, sadness is a symptom to be suppressed. In Thai view, sadness is dukkha, universal truth to be understood. By teaching mindfulness in schools, as proposed in the 90s and now a standard in many regions, they build emotional immunity. And third, the shaman as a therapist. We cannot ignore the role of the morja or shaman. In rural areas, these intermediaries provide a psychological anchor that Western therapy chairs try to provide. Listen, they validate, they perform. So, in conclusion, the West excels at emerging intervention. But when it comes to the chronic loneliness, anxiety, meaninglessness of modern life, the unipolar view is failing. Thailand offers a multipolar alternative. It says, treat the biochemistry, but also train the mind. Strengthen the body, but also call back the soul. The individual, but never sever the community. In the pursuit of mental health, perhaps the answer isn't a new pill. Perhaps it is the old path, the middle way. Thank you for being present here.